Here.
Ross,
Here.
Blott,
Here.
Snively,
Here.
Merrill.
Here.
All right, thank you. You have quorum.
Thank you very much. We'll now move into public comment. We've allotted 20 minutes total for public comment, each speaker having 2 minutes. We have 3 speakers today. The first one is Dr. Margarita Cancio. Dr. Cancio, you recognize. Dr. Cancio?
Commissioner, this is Chris
Okay,
Langley with the Hillsborough County Communications team. They do not, she has not called in yet to our line.
Okay, we'll move on. Maybe she'll call in before we end the public comment section. Next speaker is Ryan Gober. Ryan Gober. We'll move to the next speaker, Martha Price.
Yes, this is Dr. Martha Price, and I'm speaking on behalf of independent practicing physicians across Hillsborough County. We have several concerns. Our first concern is our lack of ability to acquire appropriate PPE. We have had very little success in acquiring it other than borrowing from each other and borrowing masks from dentists. Now that dentists are going back into practice, they need their own mask, and we've been very unsuccessful. We've tried to work with the state and their distribution center at Mosey, and it was very uneventful, and we're told that that will not even be a possibility to us. We need PPE because we need to screen patients, and you cannot screen patients by PCR safely without using protective equipment. The second concern we have is that if Baycare takes down their screening at the end of this week, as we've been told that might, that we have no other option but to screen in our office or send them to the limited hours at Raymond James, which is Tuesday and Thursday. And if we're seeing acutely ill patients, we need more access than that. So we're very concerned about access to screening should Baycare close down, because Baycare's drive-through has been what has assisted most of us in this whole process. So those are my concerns.
Thank you, Dr. Price. Can someone address those 2 issues for Dr. Price and this policy group, please? Anyone?
Dr.
Commissioner, this is Dr. Holt from the Florida Department of Health to Hillsborough County. I think the presentation does include a testing plan that that Gene Early and I have been forming along with the community partners. So hopefully that will provide a vision or a look ahead about expanded testing opportunities. The PPE supplies that are available through the public that we've been told through the state is not available to private physicians. We've had dentist requests. We've had a number. Our supply that we make a request that is delivered to our local EOC and then distributed, they have not allowed us to supply those providers. I'll stop there.
Okay. All right. Thank you.
Mr. Chair?
Yes.
Mike Merrill.
Thanks, Merrill.
So I will ask Gene Early to work with Dr. Price, and obviously Baycare is not the only one who's doing screening. We're doing it at 4 different centers. Other hospitals are doing screening as well. So I'll have Gene work with her to make sure that her membership has access to testing. And I'll also ask Tim Dudley to talk with Dr. Price to see if there's any PPE that we have that we might be able to share. I'm not saying that we can, but we'll do our very best. PPE is obviously still in, not adequate quantities, but both Tim and Jean will work with Dr. Price to try and resolve her issues.
Thank you, Mr. Merrill. Appreciate it very much. Thank you.
Commissioner, this is Dr. Holt again. Specific question regarding the Baycare. I know there's a representative on the call. Maybe it would be appropriate. I think they were going to speak later, but just from a timeliness, I think Carrie Eisenboss is available if you would like her to respond at this time.
Who was that again?
Carrie Eisenboss from Baycare. She's on the call.
Carrie Eisenbong?
Hi, yes, this is Carrie Eisenbeis from Baycare. I just wanted to respond to Dr. Price's question. Baycare is continuing its drive-through testing. We'll be continuing to support the Raymond James site with our community partners, which we'll go into more detail later on in the meeting. And we're still operating the drive-through sites that we have occurring in the other 3 surrounding counties as we have since March 18th. So that's all continuing.
Okay. All right. Thank you very much to all of you for answering those questions. Thank you. Did Ryan Gober call in? Apparently not.
This is Chris Lampy with the communications team. He did not call in, but we do have the first speaker on.
Dr. Cancio?
Yes, this is Dr. Cancio. May I speak now?
Yes, go ahead.
I'm the medical director of Infectious Disease Associates of Tampa Bay, which is 15 infectious disease physicians with 5 nurse practitioners. And we cover most of the area, both the hospitals and outpatient care. And I think it's very important that we realize that there are a lot of needs in the private physicians' offices. We need to be able to have access to testing for our employees so that we know that they're safe, just like the hospitals are doing. We need to make sure that we can get our patients tested when they need to, and it has been very challenging. From the beginning of all of this, I know that Dr. Price and I have worked on trying to figure out how to get that done from the beginning. And finally, we need to have access to PPE now and through the next few months. We don't even want to have anybody give us the PPE. We would just want to have access to even purchasing it at a reasonable price. So these things are needed in our community for all private practice. How is it that individuals are going to go to a dental practice if they're unable to test their employees and their staff and the healthcare workers and the patients that are coming in, and they need and everyone, whether you're a family practitioner, an internal medicine doctor, a cardiologist, an infectious disease doctor, we all need 3 things. We need to test our staff. We need to be able to test our patients, and we need to have access to buying or acquiring in whatever way protective equipment so that we can continue to have a safe way to take care of all the other problems that patients have, including COVID-19 as an outpatient.
Okay. Dr. Cancio, your time is up, but Mr. Merrill and Dr. Holt addressed those questions of Dr. Price earlier. They're going to have, I think with Mr. Gene Early, get with you all to talk about those concerns that you have. Okay?
Thank you.
Okay. That closes the public comment section. We're now going to move into emergency management update. Mr. Dudley.
Good afternoon.
Afternoon.
Teams are continuously working hard through last week out at Raymond James, Lee Davis, South Shore, and Plant City. We took in 2,290 tests collected last week. We had a total of 3,526 appointments scheduled last week. As well, as you can see, the numbers continue to go up over the past few weeks, which is that's a good sign. The word is getting out. Folks are visiting our test sites. We currently also have on hand 7,799 test kits to work with our 4 sites here. Current appointments this week, as of today, you can see significant numbers here for Raymond James, and these numbers represent over the course of the week the total days that each site is open, not just the individual day. So as of today, we have 2,951 appointments scheduled going into this week.
Okay. That's
Also, we have an update in masks. We have a change there. 490,000 masks have been distributed. Also, over 39,000 face shields have been distributed. And we received some additional donations in masks and also some additional donations in gowns. Also, we have 1 guest in our quarantine site and 5 guests in our isolation site. This concludes my updates for the collection sites and logistics and donations. Do you have any questions?
Okay, thank you, Mr. Dudley. I don't see anyone hand up for any questions at this point in time. Thank you very much. Public health update, Dr. Holt.
Yes, this is Dr. Doug Holt from Florida Department of Health, Hillsborough County. My report will consist of, again, the high-level epidemiologic report, trajectory of cases, our testing numbers in the hospital, and then continued my updates on the public health capabilities that we're building as we become prepared and are ready to be as we enter the reopening phase, specifically our long-term care facility response teams, our contact tracers. Dr. Unash will give an update on the syndromic surveillance, and as mentioned previously, the strategy of increasing testing that Gene Early will provide. Let's begin with the epidemiology. We have 1,300 cases as of this morning that's been reported in residents of Hillsborough County. 29 deaths, that's an increase of 6 since the report I did on Thursday. Again, all but 2 of these have been in persons over the age of 60. The reports, as Mr. Dudley mentioned, the reports of the results that we get back, positive or negative, have increased dramatically over the last 4 days, doubling, averaging around 1,000. We had a peak day of 1,579. This impacts both our trajectory as our new cases have significantly increased over this past 7 days compared to the prior ones. Again, not surprising given the enhanced testing. Also, on a better note, our percent of positivity of the results of all the ones we get back has decreased down to 5%. We've now tested approximately 1.7% of our residents. The only counties higher all have state-supported testing sites, Miami-Dade, Broward, Duval, Orange, and Palm Beach. In the hospital, our numbers have increased again significantly from 48 to 108. But interesting and notable, the ICU numbers have only increased from 25 to 28. Ventilator patients have decreased from 8 to 4. Demonstrated that these are in the non-ICU, lower acuity level, and has predominantly been driven by some precautionary transfers of residents from long-term care facilities. Our hospital-based surveillance system has demonstrates that the number of visits to the emergency room for flu-like symptoms has decreased significantly. Our long-term care facility strike teams, the USF, in our partnership with USF College of Nursing, expect to have some teams in action by the end of this week. Again, just as a reminder, this is a program similar to the one that the city of Tampa announced, where the nurses go out and inspect some construction sites. These will be looking at both those that have not had cases, but also those with cases. Our focus will be on long-term care facilities. Contact tracing, we have two of the state-supplied epidemiologists have been onboarded now and are in begun to work. We have 2 more coming, and the College of Public Health has identified 20 candidates for us to begin both the training and the onboarding. We've also even been approached by some private sectors for additional support in this endeavor. I will defer to Dr. Unash on the surveillance as soon as I'm done. And then finally, just some commentaries on the testing. This is a project that Gene Early and I have been working on for several weeks. He has done a remarkable job. This was only possible due to the cooperation and the leadership of all the private providers from the CEO level down of Adventist Health, Baycare, HCA, and Tampa General. I'm really certain, I know of no other county that has this level of data to this detail. Just a reminder that this does match the outline that we presented a week ago to the EPG about how to increase testing as we enter the reopening period. It is scalable. It is dependent on available resources. It's focused on active COVID cases. This is on PCR, not the antibody testing. And I see it as a temporary bridge that will ultimately, because COVID testing, as I think we've even heard from our physicians today, must be closely linked and tied to our medical providers, primary care, local MDs, through our urgent cares, even pharmacies. My final comments, just again recognize Mr. Merrill for the commissioning of the study that actually gives us also information on the public regarding testing and mask use. With that, I'll stop there and ask if Dr. Unash is on the phone to provide the syndromic update, and then we'll be happy to answer any questions.
Thank you, Dr. Holt. Dr. Unash, you recognize.
Thank you very much, Commissioner. Can people hear me?
Yes, sir.
Oh, great. Can I share my screen with you? Is that possible?
Yes, sir.
Okay.
Yes, sir.
Go ahead and click the share screen button. There we go. Can people see the screen that I'm showing up now?
Yes.
Okay. So Dr. Holt asked me to update you on where the syndromic surveillance survey that we've been doing is at the moment. This is actually the dashboard that I did a page shot on this morning. You can see that so far we've had 8,484 responses to the survey, and as a result, we're getting enough data now that we can actually start mapping hotspots across Hillsborough County. You can see that 968 of the respondents that we had the combination of the 3 symptoms that we think are probably most important: fever, dry cough, or shortness of breath. The column graphs down below the bar graphs sort of indicate the number of people who have been reporting in each of individual symptoms across all the counties. If I go to the slide here, this actually is just a picture of the map starting to drill in a little bit more detail, and you can start to see where, as you drill in and you start to increase the resolution on the map, hitting the plus button, you're able to start to see really where the hotspots are of people who are reporting in with the symptoms that are consistent with COVID-19. And on the website, if you go up to the top, you can choose Hillsborough County and your own zip, which I've done here. I chose my own zip code, 33647. And you can see just in that county alone, we've had 45 patients who have reported COVID-19 symptoms out of 441 surveys that have been reported. So the system is up and running now on the web. Terry Cordova-Hewitt has worked with us and done a really nice job of creating a cell phone, a phone-based survey with the standard, click 1 for yes, click 2 for no, sort of approach to a cell phone survey. And we're working right now to try and integrate the data that's collected from the cell phone survey back to the other surveys that we're collecting on the internet so we can put everything together as well. Moving all of this now onto the USF library site. The USF libraries have established a COVID-19 dashboard, which contains a lot of the data that's out there that you're hearing about reporting in terms of total number of cases and positives and so on and so forth. This is just a snapshot of the window that they're putting up there as well. A link to our website and our survey included on the website for the library as well. And what I'm hoping to do is to be able to integrate all of this together. A series of maps so you can go in and you can check where the symptoms are being reported. And also here, you can see on the map, though I'm not so fond of the color scheme, where the zip codes are that are actually reporting cases color-coded as well. So this is going to allow us to align where people are reporting symptoms together with actually where we're seeing testing results, and perhaps use that to, as I have said before, go ahead and move resources or identify areas where there may be potential hotspots that are not being detected by the current testing regimes, and allow us to more carefully prioritize our resources. So that's where things are standing on the syndromic survey right now. As I said, it's up and running, and all we're looking for now is to keep the publicity up and the marketing up to ensure that people still continue to go in and either call in or check in online and continue to fill out the surveys as we move forward into the opening phase of our region here. Thank you very much.
Thank you, Dr. Unash. Thank you, Dr. Holt, for your presentations. I don't see any hands at this particular point in time. So again, thank you very much for your presentation.
Thank you.
We'll now moving to Healthcare Systems Report and Summary of COVID testing metrics in Hillsborough County. Mr. Early.
Thank you, Mr. Chair. I want to share this presentation, if that's all right.
Yes, sir.
Okay. Can everyone see it?
Yes, sir.
Okay. So this is a consolidated testing and COVID-19 collection testing report by the healthcare providers that we received from Hillsborough County. And it's sort of a partnership. I want to mention Baycare, Carrie Eisenbright, Brent Barnbell, Belinda Grant, Aaron Skiba, and Sherry Hoback and Brad Harrimans for providing these reports for us. And they are senior representatives, and they've all been invited to be on the phone today to answer any questions. If you look at this report or this slide, this kind of shows you the specific areas that we requested from the providers, and it represents our first report. So there'll be some changes as we go along, and we expect that the definitions will be clarified. But this gives us a pretty good idea of the systems that we were talking about, who's participating, positive, negative for the tests that were being reported, and the total patients tested and an average per day. But please remember that all the COVID-19 results are reported to the Public Department of Health. And this report is basically from inception through April 23rd, so 2020. So some of the stuff you see here, like Lee Davis, South Shore, and Plant City, will be added to our next reports, and you'll start to see that in one consolidated place. So what was reported is total all providers was 26,764 tests, and Raymond James had 4,927 at the time that we did this report. And all four healthcare systems together did 21,837 tests. The thing that I want to mention here in this part is basically that our healthcare providers are already doing the majority of the testing. We're doing some at Raymond James and we're doing some at our satellite sites. But in the end, we're basically doing the testing, and that's pretty consistent with our healthcare system as a whole. What the county is able to do is to be able to support the providers, which is everyone in our healthcare systems, through Raymond James and through some of the other individuals. Provider reported county, this basically just shows you the positives and negatives. So we had 976 positive of those that were reported. We had 19,143 negative, 1,707, and then the total reported was 21,857. So when you look at it, that's 88% were negative, 8% were pending, and sort of 4% were basically positive for those that we reported. One of the things that we had been looking at and trying to kind of determine is the laboratory results turnaround times. So we basically ask about that as well. So the in-house was like 2 to 6 for hospitals in some cases, and as much as 36 hours in others. For external labs, it was anywhere from 72 to 8 days or 192 hours. So basically, it just sort of depends on who you were using. Federally qualified health centers, for example, had a longer period because of, I think probably because of volume that they do and those kind of things in comparison to hospitals. So Dr. Lockwood from USF had mentioned that he thought we should be doing 2,250 per day. We are currently doing 1,151, and the real difference is 1,099. So if you look at the provider testing site total capacity that we're doing now, you could do 600 collection tests more per day for a total of 1,200. You could do Lee Davis, they can increase to 600, South Shore and Plant City. And these are estimates. And then the healthcare systems themselves, we're doing 840 a day, and they could probably do 1,700 to 2,160 because they reported a total capacity of 2,500. But I want to point out that it's capacity only, and then it depicts that, and it doesn't include the resources that would be necessary to actually do that. The county healthcare systems in USF are continuing to provide invaluable support for operations at Raymond James and the Lee Davis, South Shore, and Plant City locations. Elective surgeries are now opening up, but it'll most probably increase your testing, but at the same time concurrently increase demands for the same scarce healthcare systems resources. Other testing sites within the community and the county, such as Walgreens and other community care centers, will increase their testing and may reduce demand at our existing sites. And then state and public health emphasis and priority on vulnerable populations, such as nursing homes, skilled nursing, and assisted living facilities, will increase both testing and usage of state and healthcare system resources as well. Healthcare systems are basically agreed to continue to provide our testing data on a weekly basis for the Thursday EPG meeting, and we'll get better at refining these reports. Test kits and PPE do appear to be more available than they were before based on the EOC reports. However, they're not available for everybody in the amount that they want. Testing sites continue to open up, primary care, community, and hospitals. And the EOC, in support of public health, continues to use varied approaches to maximize testing. And they've been very successful in that regard. Elimination of restrictive criteria really increased the demand. Mobile testing at home has helped as well. Targeting vulnerable populations such as nursing homes and assisted living facilities also has increased testing. Continuance of the Raymond James Central Testing Site has certainly done that as well. The new satellite testing sites for like Lee Davis, Plant City, and South Shore have both increased their access, and they basically got into areas that we wanted to do, which had to do with some of the indigent populations and people that didn't have transportation, and the walk-up testing with appointments. So the next thing that we did was I wanted to see just where we're doing testing. And I'm going to come to that through a GS map that we've included. But I first want to talk about collections and testing expansion, because I think you've heard this in a number of ways. I hope this is a good way to do it as well. If you look at the bottom here, these are where we get our resources: healthcare systems, county resources, federal, state, and our local resources. And we depend on those for our PPE kits. We depend on our healthcare systems for staffing and USF and other groups. And then we depend, in order to expand this testing and sites, we need to have the demand correlate to what we're putting out there. Otherwise, we're not using our nursing resources and other things efficiently. But if you have these resources available in the base, and you have the staffing, demand, and the PPE kits, then we could begin testing, an expansion of testing. The other thing I want to mention here is that, ultimately, we have a healthcare system, one of the best, in the state of Florida, I think, for our healthcare systems, when you put them all together in the way in which they've come together. And I think that they are an amazing group of people that are doing some really good things, but they do need the other things: PPEs, demand, and they need the staffing. So when you look at the access points available, we don't think about it very often, but the testing sites are all over Hillsborough County. Now, not all of them are doing, unrestricted testing like we're doing at Raymond James and in Plant City, Lee Davis, and South Shore areas. But you can see that TGH, Baycare, all of them, HCA, everybody, Advent Health, they all have testing sites all over the county. Now, this is done by your areas, that are basically the districts, but it's done by areas where we have indigent populations, and you can see where this starts to show up. This is especially at 138% of the poverty level. These are areas like that are tinted in this salmon or pink. This also represents our HCP participating hospitals. It shows some of our community resource centers. Now, this one is because I'm in the Hillsborough County Healthcare Plan as a department, and I wanted to see where our access points are in comparison to the Hillsborough County Healthcare Plan members. And as you can see, we've got a really good testing access for most of our people, but there are some that are still not out there. So when you start to develop your strategies for increasing testing, please remember that it takes demand, it takes resources, and it takes protective equipment to be able to do that, and we're still not all there yet. I think that the EOC has done an amazing job in trying to do that, but at the same time, those are very important pieces. But if you're going to increase the testing, you can do it. Either you can increase it through healthcare systems, which is basically the existing testing site capacity. You could open it up to new sites for increased testing. You could disperse it into the existing healthcare systems that I just showed you, and increase their ability to be able to do the testing. You can partner with other private community providers. DOH, for example, the health contract tracing in partnership with USF. And finally, you could contract with other ambulance contractors or others like that, such as staffing to get your nurses or whatever. The point I want to make here is that you have a lot of strategies, but you must get the demand and must have the resources and that includes HR and the supplies and the PPE. So having said that, I'd like to acknowledge Dr. Holt and Ryan Pedigo, the Fourth Healthcare System Partners, Dean Charles Lockwood, USF Health, and the FQHC Suncoast and Tampa Family Health Centers. The EOC and the healthcare system clinical teams that are working on the front lines of Raymond James and the U.S. clinical staff at Lee Davis, Plant City, and South Shore. Donna St. Louis, who is an RN at Baycare Healthcare Systems, and the site commander, which is of our staff, John Paul Lavanderia. I just have to acknowledge their outstanding leadership, both clinically and administratively. Adam Smith of TGH and Jennifer Hall of our staff from communications for their continued support that supports the appointments made for all these collection and test sites. And I'd also like to acknowledge Miss Adria Kopica. She keeps everything on track. She's the project manager for Raymond James. And then Mr. Jim Dudley, Chief Jones, Greg Cordell, and Mike Merrill for the support of this program. And I'll stop there and see if you have any questions.
Thank you, Mr. Early, for that intense report. We appreciate it very, very much. I don't see any hands for any questions. Again, we want to thank you very, very much for that report. We'll now move on to COVID-19 testing awareness community outreach survey updates. Mr. Robert Allen.
Thank you. Can you hear me?
Yes, sir.
And can you see the screen?
Yes, sir.
Awesome. Thank you, Mr. Chair, members of the commission. My name is Robert Allen, Vice President at HCP Associates. I'm here today to speak to the multi-channel outreach regarding COVID-19 testing access. The focus of our initiative has been to gain insights from the community during this crisis and to understand any barriers to access that they may have. 2 weeks ago, we began the process alongside the team at Hillsborough County and devised the following multi-channel survey approach. This consisted of a telephonic survey, a text message-based survey, and an online survey. With about 2 weeks worth of data having been collected, we have a tremendous amount of citizen input. Over almost 12,000 responses as of this morning, but as of the time of the analysis, 11,688. Almost 1 in every 125 Hillsborough County residents have participated in this survey. When we look at the zip code responses that the respondents volunteered, we do see a tremendously good and even distribution of responses throughout the county. Some of the more active areas would be the Sun City Center area, which almost had 1.5% of the entire zip code's population participate in the survey. On the other hand, some of the other zip codes that have smaller participation include zip code 33620, which corresponds to the USF campus, which of course, as we all know, is mostly depopulated right now. So what we really explored in our top line findings here are, would people go out and get tested? And the answer is yes, 90% of county residents would go and seek testing for COVID-19 if they felt sick. We also wanted to explore health and safety practices, and we found that 77% of county residents would take wearing a mask in public very seriously. Finally, we wanted to explore why people may not seek testing or may not wear a mask in public. The biggest issue we identified was that 11% of county residents have concerns about being able to afford either testing or treatment for COVID-19. These are the several factors that we tested that may prevent people from receiving COVID-19 testing. One of the things we wanted to immediately understand was whether transportation access was a large factor for many county residents. We have not found that in the data, and the many new testing sites that are available have certainly ameliorated that fact. However, again, as we look at this, most of the concerns come from finances, whether that's a lack of insurance or not knowing that the testing is free, or thinking that if they were sick, then they have to go to the hospital and they may not be able to afford that bill. So these affordability concerns are really foremost among county residents across the county. We also wanted to explore mask use in Hillsborough County. We tested several different safety practices, such as social distancing, such as avoiding going out unless necessary, such as washing your hands more. And we found that in almost all of those cases, the percentage of population taking that very seriously was very high, in the 90%. The exception to that was mask use. Again, 77% is very good, but it is lower than we saw with the other safety practices. In general, when we asked about any factors that might be discouraging mask use, discomfort was the single most cited one, but it was only cited by a small portion of the populace. Additionally, we looked into citizens' top household concerns at this time. What we found is that there is a very mixed message in terms of primarily being concerned about the disease itself, but also being concerned about the downstream impacts that the shutdown has had on their lives, on their mental health, and on their economic situations. So to look at these 5 factors, becoming infected or someone in their family becoming infected at 48% is the foremost concern, but then impact on my community, emotional and mental health of my household, and supply shortages in the stores, not being able to do the things I love to do, coming not very far behind this disease itself. As we move forward with this, we're going to be digging into some time series analysis to investigate changes in opinion. One of the areas we're very interested in is the food availability issue. There's been a lot of coverage in the news lately about the potential for food processing plants to be closing, and we'd like to see if the data reflects that concern. We'd also like to dig into the zip code analysis in a deeper sense to look at the individual responses to each of these questions and to then provide that feedback to Hillsborough County Communications so that they can drive targeted data-driven communications to those specific zip codes. Thank you so much. If you guys have any questions, I'm happy to answer.
Thank you, Mr. Allen. We appreciate your report. At this time, I don't see any questions on your report. So again, thank you so very much. We appreciate it.
Thank you.
We're now moving to EPT discussions. Is there any items we need to bring forth today for discussion? Mayor Ross, you recognize.
Thank you, Commissioner. I had my hand function's not working again. I don't know if Mr. Early is still on the call or not. I did have a question regarding his report, if that's okay, sir.
Mr. Early, you still there?
I am.
Yes. Go ahead, Mr. Ross.
Mr. Early, this is Andy Ross. Normally I try to stay at the policy level and stay out of the weeds, but I did have a question about your report.
Yes, sir.
At the beginning of our call, we heard from public comment from a couple of doctors that they're having trouble getting their patients and staff, nurses, and those types of things tested, which I know there's a variety of reasons for that, PPE, the test kits, and so forth. But in your presentation, we heard how we need to keep the demand up so that we have plenty of test kits right now. We're trying to increase the demand and increase the testing pool. Just for your consideration, and maybe Mr. Merrill or Dr. Holt, I'm not sure who would be the decision maker here, but couldn't we marry these two problems up and prioritize at least on the short term, the staff and patients of these doctors that are needing this testing in the short term? Now, that's not the long-term solution. They need their own PPE. I understand that. But if we have test kits available, couldn't we prioritize doing tests for them in the short term?
I think that the EOC and the State Department basically and everyone else has got some priorities that are kind of inherent. One of them is that when you're trying to do these larger sites like Raymond James and you're trying to do the satellite facilities, you have to have a certain amount of resources available to do them and to continue them. So for an example, if you're going to make appointments for next week, you'd have to have those resources available. Otherwise, you'd have people with appointments but no resources. So they have to monitor it from that perspective. And then I think that there's a number of priorities that have been placed on the state and everyone else. They're basically concentrating on the nursing homes, the assisted livings, the places where the most vulnerable populations are. And then on top of that, you have your hospitals, and they basically got a lot of the PPE because of the acute status of their patients. So I think that you want to marry them, but I think that you have to wait a little bit till we have more PPE that's available for the whole universe. Does that make sense? I'll stop there.
Good, thank you.
Commissioner Overman, you recognize.
Thank you, Chair. I appreciate it. I actually do have a question for Dr. Holt, one for Dr. Early, and one for Robert Allen. If you'll indulge me, I'll run in that order. Dr. Holt, well, as you're collecting data, what will be your response to should a surge arise, and how and when will you notify this body if you believe we need to take action?
Your first question is how will I respond? And that's mostly how we have our contact tracers that hopefully are expected or to do the case containment strategy. As far as communication, I will continue to update regularly. I can work through Mr. Merrill and reports through both the county commission and the cities as long as this board's active, and clearly this is the appropriate forum. So I will work within the structure to provide this information widely available to our elected officials. I'll stop there.
Thank you, Dr. Holt. So do you have an increase of exposure or test positive range that you'll be working on to raise the sort of warning flag should we get there? I mean, there's several things we as a community are required to do: provide testing, PPE, hospital capacity, those kinds of things. Do you have a set of metrics that would suggest to us that we need to take action in the future?
At this time, the state Department of Health is creating what they will be utilizing across the state for each county to use. So there's some consistency across both certainly region and the counties. So I will follow their lead as far as what is those triggers as you refer to. I think that would be my answer. I'll stop there.
Thank you very much. Dr. Early, I really appreciate your report. That was excellent. I was curious, with 82% of the tests being collected at our healthcare providers or with our healthcare providers, can you confirm that the testing at those facilities is free and does not require insurance?
I can answer what I believe it to be, and then we have four of our, I think at least some of our healthcare providers on the line. I believe what's happening right now in the healthcare systems is that if the people have insurance, they are basically billing their insurance companies. But if they don't have insurance or don't have any available means to do it, I believe they're not charging them. It's for free. So that's where I think it is. Carrie, are you on from Baycare? So I guess I'll state it. I believe that's how that's working right now. They're billing the managed care organizations and the insurance companies if they have insurance, and if they don't, then they're basically for free. That's the way my understanding of it is. Is anyone left on the healthcare systems?
Hi, Jean. It's Carrie Eisenbein.
Oh, hi, Carrie. Is that correct, Carrie?
Yeah, I think you summarized it. I mean, the drive-through testing that we're doing in Hillsborough is at Raymond James. So you all are familiar with the process there. At our other facilities and drive-through sites, Baycare is not collecting upfront payments, but we are collecting patients' insurance information. As you know, most of the new protections in the federal law compel insurance and government payers to cover the entire cost of the test. And for patients who do not have insurance, Baycare will work with the appropriate government agencies to cover the cost.
Ma'am, could you repeat that last part about the federal government and concerning insurance? Because I think we're getting ready to have some issues, some confusion here. Could you repeat that, please?
What I was saying is that with the federal legislation that's come out in the last few weeks, most insurance companies and government payers are required to pay for COVID testing.
So if someone goes to either Raymond James or to the other 3 sites, and you're asking for the insurance documentation?
Raymond James, Raymond James, I can't speak. I don't think they're collecting the insurance information at Raymond James. That's a county-run site. I was speaking about Baycare drive-through collection sites and other locations.
Being South, the one in South County, Lee Davis and Plant City.
No, I'm speaking about Baycare has other drive-through
other sites
in other counties, Pinellas, Pasco, and Polk County.
So they're taking those to the insurance companies as other counties, but Hillsborough County is not?
I think the distinction is Hillsborough County, the Raymond James site, is a government-run site, and there's criteria there for how patients are taken in terms of their information. But Baycare also runs other testing sites in other counties that we run ourselves. They're not county or government-run sites. So that's the distinction.
Let me ask the question this way, because I can see this becoming a quick issue as soon as we get off this call. In Hillsborough County, if someone goes to get the test any place in Hillsborough County, are they being charged? Will the insurance companies be billed, or is the test free?
Yeah, I can't answer that question for Hillsborough County. I'm answering it for Baycare.
Okay.
Commissioner Miller, this is Liana Lopez. I'd like to help clarify from a communication standpoint what we are communicating.
Go ahead.
Okay, so if it is a Hillsborough County community testing site, which is Lee Davis, South Shore, Plant City, and Raymond James, the test is free. We do not ask insurance. So it is free. Anybody can get tested, and we do not ask insurance. As far as what the private providers do on their own properties in their own areas, as they talked about, they are running through insurance. But we are only communicating from the JIC side, the community testing centers. So they are free and insurance is not required.
Okay, and that's what I want to clarify, because in this meeting, as soon as we get off this call, you can bet your bottom dollar that we're going to start getting phone calls saying, wait a minute, I thought the test was free. Now they're going to bill me, or we're going to go through my insurance, which I didn't want to have happen. And I thought, in Hillsborough County, I thought it was free. So there was some confusion there, and I want to clarify that. I'm sorry, Commissioner Overman, to take over your question, but when she said that, that flag went up. So I just want to make sure we're perfectly clear. Commissioner Overman, you have the floor.
Thank you. That's actually exactly why I asked the question. But thank you very much.
I didn't mean to take it over. I'm sorry.
No problem. No problem. And that relates to the question I have for Mr. Allen. It is clear that residents are concerned about the cost associated with the testing as well as their treatment. It does appear they're concerned. So, and it was apparent by zip code or demographics who was most concerned about. Was it apparent? Let me rephrase that. Was it apparent? By zip code or demographics, who was most concerned about the cost? If certain populations were identified, do you have a suggestion on how we effectively communicate to that group? We need to make sure that we are persistently communicating that our testing, the county's testing at our site, does not require insurance and is free. So how do we say that in a way that clears it up for our citizens? Because clearly they're still confused. And I'll stop there.
To speak to that question, we do ask a preferred channel of information of the respondents. So we have not looked at every zip code by all of these questions at this point. That's really going to be the focus of this week's analysis. But to your point, we have the zip code data. For the telephonic survey, we have additional demographic information. And as well, for all the survey instruments, we have preferred channels. So what do they go to things on the internet? Do they like text message alerts? Text message alerts were actually much more popular than we had anticipated. So we will be looking into that, and that will be the next phase of our reporting.
And Commissioner Miller, if I could be recognized, this is Liana Lopez. I'd like to add to that.
Yes, ma'am.
It's important to recognize, Commissioner Overman, that the survey also started before the testing criteria changed last week. And so that when Robert referred to, we're going to start looking at time comparisons as the EPG makes decisions or communication messaging changes. We're hoping to maintain about 150 to 200 respondents per day to be able to do that comparison. So how did they feel before the message changed, and what was their behavior, and what are they doing now that the messaging is changing, so we can see where we're being effective, if that helps.
Thank you, Liana. My concern is I'm concerned. I don't know if we're asking this question. Are you avoiding testing because you're worried about the 14-day quarantine period after a test? I mean, how many people are saying, I don't want to go get this test because I'm going to end up having to miss work while I wait for the test results? Is that embedded in your survey?
That is, yes. And it does not poll nearly as highly as many of the other concerns.
Okay, great. Thank you.
Commissioner, thank you. Commissioner Merman, you recognize.
Thank you, Mr. Chair. And Liana, I just want to ask one question about the free tests. Do you think it would help if we added a statement that said all Hillsborough County sites are free, or something like if you, I don't know what I'm trying to say, you could go to another private site like Baycare, Tampa General, Advent. You could go to the Advent site at Busch Gardens, and actually, because they've heard in the communication that tests are free, now they're going to go to one of these other sites and think it's free, and then they're going to be asked for their insurance. So I think this is the problem with communication, is that we get every information is a little bit different, and somebody may be going to a testing site because it's closer to their home than another, maybe a site that's in Hillsborough County. So how do we not have confusion about payment on other private sites that are not by Hillsborough County? And can any statement be added to?
Yes, Commissioner. So we are communicating that Hillsborough County's community testing sites, and we list the 4. That's why it's important to call that 272-5900 number, that is free and insurance is not required. We do stay in communication with our public affairs partners at the hospitals. They are part of the Joint Information Center, and so we are coordinating, but we are keeping our message clear and focused on the 4 sites. And I can tell you, since last Monday, on the 27th, when the testing criteria changed, we have more than doubled capacity at the testing sites, and we believe that our reach is there. We have the call center is very, very busy, and they're scheduling tests.
Okay, that's good to have that reassurance. And
we're going to stay consistent.
Oh, good. I do want to thank Dr. Holt and Jean Early for their very good information reports today about the data collection. And I see that we're all getting on the same page. And I really thank you for developing that repository, because we now have the full picture of pretty much all the testing that's going on in Hillsborough County. So we can get a true picture going forward. So I thank you all. Thank you for your efforts.
Okay. Is there any other issues we need to discuss today? Anything else? Ms. Snipe, do you recognize?
Thank you, Chair Miller. This is just really for clarification and transparency. I've been contacted, as has been our local House representative and our local commissioner representing a lot of the parts of unincorporated Hillsborough County, asking for clarification on trails. And I know there's some recreational parks and areas that have been opened up, but it's my understanding that is not under the EPG's jurisdiction. That's under Mr. Merrill and the BOCC jurisdiction to open up some of the hiking trails and some of the horse trails that are in the unincorporated parts of Hillsborough County. Can I get a little bit of clarification on that for my constituents as far as whose jurisdiction is that and what the plan is to reopen some of those? That would be a question, I guess, for Mr. Merrill or Ms. Beck. Thank you.
I provided at your last meeting the list of trails that were being opened, and those have been published through social media and on our website. Be happy to have someone send you that directly if you like.
That would be great. I would love to be able to send that to some of the constituents, and then I will go find the social media post and start getting that communication out. And whatever the county can do to continue to push that information out is very helpful and appreciated. Thank you so much.
Mayor Lott, you recognize.
Thank you, Mr. Chairman. I have a question for our County Administrator, Mike Merrill. Due to the amount of time and the number of people it takes to put on these meetings twice a week, I just was asking and his advice on, at the pace that we're at right now in dealing with COVID-19, is there necessary for us to continue to meet twice a week, or would you be better off redeploying your personnel and all the personnel that's involved in this meeting to other activities to help our community and have our Thursday meeting instead of having the Monday meeting as well? Just wanted to see where your thoughts were on that.
No, I very much appreciate you bringing that up. And yeah, up until, now, I think there's been plenty of substantive issues for the EPG to deal with. It is a tremendous amount of work. This week, for example, I and my folks have 2 EPG meetings and a Board of County Commissioners meeting to prepare for and staff, and it clearly takes time. We'll continue to support the EPG any way you want to, but doing what you suggested would be a huge relief and allow me to deploy people on the ground to do more work. So I very much appreciate you.
I'm hearing a lot of needs, and you have obviously personnel that could maybe help some of the issues that we've heard today in our public comments, as well as some of the comments that we brought up here today. And it seems like you could redirect that. I'm not telling you how to do your job. I'd never do that, but it just seems like it give you the opportunity, if need be, to redirect your staff a little bit to be able to hit some of these issues versus, if the need is still to have this meeting, all for it. But it sure seems to me like where we're at in this stage of the game, we could go to a Thursday meeting and drop the Monday meeting if that's good with you.
Yeah, that'd be terrific. I'd appreciate that.
Mr. Chairman, does that take a motion?
Yes, sir.
Okay, then I will move for us to remove the necessity of having the Monday meeting and for us to continue to have our meeting every Thursday.
I'll second.
I'll second that.
Hold up. Motion by Mayor Lott. Who was the second? I heard a lady.
Commissioner Merman.
Who is it?
Commissioner Merman.
Commissioner Merman. Have a motion by Mayor Lott, second by Commissioner Merman, that we now have only one meeting per week, being Thursday at 1:30. Is there a discussion? Commissioner Merman, I see your hands. You want to discuss this?
I just want to make a point, though, that if, say, there is a surge or there's something else that comes up that means we need to have another special call meeting besides a Thursday meeting, that Mr. Merrill will consult with you. So there is some flexibility in that where we can still have the additional meeting if we need to. Is that correct, Mr. Merrill?
Yeah, of course I would do that.
Okay.
Now that was going to be my comments, that if we have a surge, that Mr. Merrill and myself get together and we have to call another meeting, a special meeting, a call meeting any day of the week because of the mere fact is that things are taking a turn for the worse. We will definitely do that. Is there any other discussion on the motion by Mayor Lott, second by Commissioner Merman? Seeing no hands. Mayor Castor, you recognize.
Yeah, I would just say that I can't imagine going to a once a week meeting, clearly whatever the board votes on, but we just now today opened the community back up, and that is going to result in an increase in cases and positive cases. We just had 3 people die, which is an increase in the number. So I think that the public deserves to have the information in a timely fashion. And if we wait until there's a surge to increase the number of meetings, then that's going to confuse the public even more. That's it. Thank you.
So what's your suggestion, Mayor Castor?
Well, I would say at the very least to continue on for the first 14 days of phase 1. I mean, we opened the community today. That is huge. That's huge. And we did away with the safer at home order. So I realize that it's not inconvenience, but it's a great deal of work. But I feel we owe it to the community to keep them informed.
So you're suggesting that we meet twice a week, this week, twice a week, next week, and see what happens the 18th, week of the 18th?
That would be my suggestion, just as we open up, just to see, what's going to happen. We all agree this is uncharted waters. And so we're making decisions now that we're not sure what the impact is going to be on our communities.
So would you like to make a substitute motion that we do this effective the week of go to one meeting per week effective the week of the 18th?
Yes, or make a decision in the week of the 18th how to move forward. If this first phase goes as well as we hope it will, then we could go back to the 1 day a week.
Okay, so what are you going to do?
So I would, if it's okay with Mayor Lott, then I believe it was Commissioner Merman that seconded to amend the meeting to make that decision the week of the 18th to see how this phase 1 goes for our communities.
So that's an amendment to the motion. Is there a second?
I'll second that. It's Commissioner Overman.
We have an amendment to the motion by Mayor Castor, second by Commissioner Overman to amend that to look at going to one meeting per week, deferred to the week of the 18th. Is there any discussion on the amendments to the motion? Mayor Lott, you recognize.
Sorry, hands down.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. I'm really okay with this. Actually, we've already met today and we have Thursday. So it just entails us meeting again next Monday. So I have no problem with this going forward. And the mayor is really kind of spot on this, that, the first 14 days, we need to be vigilant and make sure that all the data that we're getting, that we keep getting, that we look at and we make our best decisions based on that data.
Okay. Thank you, Commissioner Mayor Castor. To make this a clean motion, why don't you withdraw that as an amendment and make that a substitute motion?
Okay, substitute motion that we continue to have meetings every Monday and Thursday until the week of the 18th, and then make a decision on having a meeting once a week as opposed to twice.
Commissioner Overman, you still second that substitute motion?
Yes, sir.
Okay. I see no discussion on the substitute motion by Mayor Castor, second by Commissioner Overman.
Commissioner,
please call.
Mayor Ross is calling your attention.
I'm sorry. Who is this? Mayor who?
Commissioner
Ross, you recognize.
Thank you, sir. So just to be clear, what we're voting on, we're really voting on nothing. We're voting to write this on May 18th. Is that correct? So we're just voting to put this on the agenda for the 18th.
We're voting. Well, basically, yeah, we're voting to continue meeting twice a week, and we'll discuss it again on May 18th as to whether we'll go to one meeting a week.
Okay, so we're just voting to put it on the agenda for May 18th, essentially.
I thought.
Essentially, yes, but record-wise, more important.
Okay, thank you.
And let me tell you why. When we finish this meeting today, myself and Mr. Dudley and Chief Jones and Ms. Leanna Lopez, we get on a phone call with the press, and believe me, they'll be asking questions, and we want to make. I think we need to make everything crystal clear to the press to make sure we have no mistakes like we had with the date of the 15th of May. So I think this is the best way to do this. Okay, Mayor Ross? Answer your question, sir?
Yes, sir. I'm sorry. I was on mute. Yes, sir.
Okay. All right. Very good. I see no hands, so please call the roll on the substitute motion.
Miller,
Yes.
Overman,
Yes.
Marmon,
Yes.
Cronister.
Yes.
I'm sorry, could you repeat that?
Yes, sir.
Thank you. Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 8-0.
Okay. Thank you very much. Any other items we need to discuss? Any other items to discuss? Mr. Merrill, anything you need to bring forth, sir?
No, nothing for me.
Okay. Seeing that we have nothing further to discuss, thank you for joining us today, and you all have a great remainder of the day, and we'll get together again on this coming Thursday at 1:30. Therefore, this meeting is adjourned. Goodbye.
Have a good day.
Florida Department of Health is working around the clock to identify those who are most at risk of contracting COVID-19. We are prioritizing testing for any individual who is symptomatic, fever, cough, shortness of breath, and has traveled through an area of community spread. We encourage them to contact their medical provider. Please don't self-diagnose. Describe the symptoms that you are having, work with your provider, and if your provider feels that you meet the criteria for COVID-19 testing, they can coordinate through one of the commercial labs, LabCorp or Quest. There's a two-step process, which includes a specimen collection kit and then a test kit. The specimen collection kit includes the swabs and the sputum culture that are collected from the patient, which are then sent to the lab where the testing kit is housed. The testing kit includes reagents, which are basically chemicals that run the test to prove whether the person is positive or negative for COVID-19. We encourage social distancing because it is very easy to spread through droplet transmission, meaning if someone coughs or sneezes near you and you breathe that aerosolized matter in, you are now possibly infected with the virus. We want to isolate the sick for 14 days because that's typically the duration of this virus. At the end of the 14 days, if they are symptom-free, then they have the potential of testing negative for the virus. But they do have a clearance process for those individuals. For the latest information on the COVID-19 virus, we encourage everyone to visit the Florida Department of Health and the CDC websites.
The Florida Department of Health wants you to keep practicing social distancing. If you need fresh air and would like to do some outdoor exercise, that's okay. However, if you're around other people, keep 6 feet between you when possible. Avoid hugs, handshakes, large gatherings, and close quarters. If you have a cough, fever, shortness of breath, or sore throat, stay away from others even if they're in your same household. Doing your part will save lives. Please visit floridahealth.gov and the CDC websites to stay informed. The length of time that COVID-19 survives depends on factors. These factors include the type of material or body fluid containing the virus and various environmental conditions such as temperature or humidity. Researchers at the CDC and other institutions are designing standardized experiments to measure how long COVID-19 can survive in situations that simulate natural environmental conditions. So until more is known, clean often, especially high-touch surfaces. If you live alone and become sick during a COVID-19 outbreak, you may need help. Ask family, friends, and other healthcare providers to check on you during an outbreak. Stay in touch with family and friends with chronic medical conditions. Please visit floridahealth.gov and the CDC websites to stay informed.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety agencies to address any impacts coronavirus may have on our local community. Not everything is known about the coronavirus yet, but the Center for Disease Control and Prevention, CDC, has narrowed down key symptoms of the virus: fever, cough, and shortness of breath. The CDC says these symptoms may even appear 2 to 14 days after exposure to the virus. If you experience these symptoms, you're urged to stay home and call your doctor. It's important to know the difference between symptoms of the coronavirus and other illnesses. The CDC says people who have the flu will often feel some or all of these symptoms: fever or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, allergies. The common symptoms of seasonal allergies include sneezing and an itchy, runny, or congested nose, itchy, red, watering eyes, wheezing, chest tightness, shortness of breath, cough, raised, itchy, red rash, swollen lips, tongue, eyes, or face, dry, red, and cracked skin. You should call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID-19. We encourage you to visit floridahealth.gov for up-to-date information and tips.
Once the Florida Department of Health has confirmation that someone tests positive for COVID-19, we go over where they've gone and who they may have exposed while they were infectious. Then, we speak to the person and go over do's and don'ts. They are given a way to get in touch with us directly 24 hours a day, 7 days a week. When we check on the individual, we continue to remind them of do's and don'ts. Each situation is a little different. Some people live alone. Some live with others. Some may have to temporarily relocate to protect high-risk family members. We work with the individual, the immediate family if they have one, and community partners to ensure their needs are being met. The Florida Department of Health, along with its partnering health and safety agencies, is reminding residents to stay vigilant and help stop the spread of COVID-19. People with confirmed or suspected COVID-19 who do not need to be hospitalized, or those who were hospitalized and determined to be medically stable to go home, should restrict activities outside their home except for getting medical care. Do not go to work or public areas. Avoid using public transportation, ride-sharing, or taxis. Be sure to separate yourself from other people or animals inside your home. You should stay in a specific room and use a separate bathroom if available. Call ahead before visiting your doctor. If you have an appointment, call the healthcare provider and tell them your symptoms. This will help the office take steps to keep other people from getting infected or exposed. Household members and caregivers who have close contact with someone who has confirmed COVID-19 should stay at home and monitor their own health and call their healthcare provider right away if they start developing symptoms. We encourage residents to visit the Florida Department of Health and CDC websites for more on this topic. If someone is exposed and infected with COVID-19, the virus will not show up in a test until 2 to 14 days after the exposure. In the early stages of the infection, it is possible the virus will not be detected, which gives a false sense of security. That's why it's important to have a healthcare provider determine the best time for a COVID-19 test. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health understands that some of you may be concerned about your pets. The CDC has not received any reports of pets or other animals contracting COVID-19. However, it is always a good precaution to wash your hands after touching an animal. People with COVID-19 are asked to limit interaction with pets and other animals. Specifically, while they are symptomatic, they should maintain separation from pets as they would with any household members, and avoid direct contact with pets, including petting, snuggling, being kissed or licked, and sharing food. Please visit floridahealth.gov and the CDC websites to stay informed. The Florida Department of Health wants to stress the importance of speaking with your healthcare provider. It's a bad idea to self-diagnose and tell a healthcare provider, I have COVID-19, I need to get tested. A healthcare provider may not take you seriously if you do. If you have a fever, cough, or trouble breathing, call a healthcare provider and describe your symptoms. Your healthcare provider will then help you with your next steps. To be safe, you should avoid close contact with others, especially those in your household